public appetite for the Irish cosmetic industry has grown exponentially over the past decade. Well, here to examine the merits of availing of medications and procedures is clinical psychologist Dr. Anne Keogh, cosmetic surgeon Dr. Patrick Treacy, consultant bariatric surgeon Professor Helen Heenahan, and welcome along to the programme. I want to come to you, Dr. Patrick Treacy, because you are at the forefront of this industry in the area of cosmetic surgery and procedures. Tell us about the kind of demand you're seeing now as distinct from where we were at around 10 years ago.
Okay, well, in many ways, Claire, we should differentiate between cosmetic surgery and aesthetic medicine. Aesthetic medicine really has, in many ways, gone exponential. It probably is now, they reckon, running at the rate of 10.4% per year. And cosmetic surgery, in some ways, is coming back a little. I mean, it's certainly there still for, like in Helen's field, and facelifts tend to be done now by either dermal fillers or radiofrequency machines.
So when you're speaking about aesthetic medicine, just to clarify, you're talking about injectables and fillers and non-surgical intervention.
It doesn't need, we'll say, intubation, conscious sedation, overnight stays, intubation, anaesthesis. Even though a lot of my cosmetic work tends to be involved also with skin cancer per se, I'd be very well aware of the growth of the industry. We, after all, started off the first, I suppose, aesthetic medicine clinic in Ireland back 1999. And we would have been dealing with a lot of complications from all over the world, from Dubai, from America and everything over the years. But a lot of the procedures now can be reversed with hyaluronides. And may I say that Dublin was the first place in the world to use hyaluronides many years ago. And but now most people in aesthetic medicine can reverse a lot of the problems themselves.
And how has the client base changed? It's obviously more affordable, isn't it? If you're not opting for surgery,
it has become totally acceptable. Unfortunately, we've got a hierarchical system. It's like a triangulation upside down. So doctors and dentists, to an extent, nurses are on the top of this. But we've got a situation, I suppose, now where hairdressers, people doing nail varnish, technicians, beauticians are all injecting. And what we're trying to do, particularly for dermal fillers, is to try and make it within Europe prescribable only medicine rather than a medical device. So if we had it the same as it is in the United States, we wouldn't be facing the deluge of problems that we're seeing almost on a daily basis.
Okay, so just to... When you say there's been a huge demand and it's exploded, really, the interest in
we're
aesthetic medicine.
Across the clinics 4 months
What do you put that down to?
3 factors. We'd have to take into account influencers, celebrities and social media. That certainly plays a big role in the problems we're seeing. There's no doubt about it that people with the best Instagram accounts tends to attract that sort of market of people. The second thing is most of the procedures are fairly safe and people can get procedures done very quickly. And as a consequence, they can look a lot better. There's no doubt about it. The problems often exist on twofold. Number one, the products they're putting into people's faces sometimes can cause granulation tissue down the line or nodules. And they can be delayed onset almost 3 to 6 months later. And the second thing is people that don't know human anatomy very well, and they're injecting into blood vessels and causing dermal filler necrosis. I was in London on Saturday, and we had a whole forum on dermal filler blindness being caused by injecting faces. There's now about 300 cases worldwide. And we've come up again with a technique how to reverse that, hopefully.
All right, okay. So
we've had 5 people reversed.
Representing some of the real problems that people are seeing as a result of getting, I suppose, procedures in the wrong hands. I want to bring you in.